Hi there, and welcome to Unfiltered Solopreneur, the podcast where we share real, unvarnished stories of people who dared to break free from the corporate grind. I'm your host, Nikhil, and I'm passionate about helping solopreneurs like you turn their dreams into reality. This episode contains discussions of suicide, substance abuse, and mental health. If you need support, resources are listed in the show notes. What happens when a military veteran and suddenly unemployed IT professional decides to fight a battle most people don't even see? In this episode, Mathew Snyder reveals how his personal trauma became the foundation for a mission that's saving children's lives across America. We explore why pharmacies aren't the answer, how sheriffs might be the unexpected heroes, and the shocking reality of medication safety in American homes. Buckle up for a raw conversation about turning pain into purpose. I'll see you on the other side with my reflections. Hello and welcome to a new episode of Unfiltered Solopreneur. I'm your host, Nikhil Vaish, founder and CEO of Boost Solo. My next guest went from fueling fighter jets to fighting for safer homes. He's a veteran turned founder on a mission to prevent medication tragedies with heart, grit, and a whole lot of persistence. Mathew, welcome to the show.
Hey, Nikhil, thank you for having me.
Well, I want to start by saying thank you for your service.
Oh, you're
And
welcome.
then I'm going to dive right into our questions, right? You, um, so your journey from Air Force veteran to founding Remedy Guard is quite a path. But you also mentioned to me in September 2021, you were laid off the day before your birthday. And you said you already knew what you'd do next. Can you take us to that moment and also talk a little bit about why you were so certain you were ready to start your own thing?
Absolutely. So just coming off Labor Day weekend, got into the office and it was like, hey, we've made you redundant. We can either get a seasoned, C-level, CTO, CIO for what we're paying you, or we can pay junior peanuts and continue on using the infrastructure that you built. And it's like, cool.
Yeah.
And so I had been, doing uh, e- IT in e-commerce fulfillment, and one of the companies that I was handling did medication lockboxes, and I was seeing firsthand the breakdown of our supply chain during the pandemic. And because lockboxes weren't getting out there, parents and guardians weren't locking up the things that, needed to be locked up. And I didn't know anything really about this. I was just IT. But because of my lived experiences and how I grew up, I just knew what was going to be happening. Fast forward to now, and the number is 35,000 children under the age of 5 who go to the ER every year because they got into medications left out.
Wow.
And that's kind of tip of the iceberg when, implementing lockboxes into communities on a national scale. You know, as we get older and get into our teen years, the conversation becomes more difficult because, our kids are getting into stuff to intentionally end their lives. And, as someone who tried that in their teen years, when I was around 15 years old, because it's that 15 to 17 year mark or gap in there that just the rates are, it's
Very
through the
high.
roof, and it just keeps getting worse. This type of a device, coupled with that education that comes from uh, empowering public health to operate within their community, that's what makes the difference. Because you can't just tell people to go do something. They're not going to do it. You can't just have boxes on a shelf. It's not going to be as impactful. Couple them together, and that's what makes change. And again, I know what happens when drugs get into a community. I'm originally from Southern Oregon, and to this date, Oregonians consume meth at a rate 70% higher than any other state.
Wow. I didn't
Uh,
know that. Yeah.
it's It's ridiculous. Part of it is it's a very geographically separated area, very, very rural. Uh, not not much entertainment out in the woods. So, uh, but growing up, there was this huge issue with meth. And I remember, like, the signs popping up at the gas station, like, meth, not even once. And, like the progression of cooking or, like Breaking Bad, literally, in
Yeah.
Oregon. And it took, well, one, it got so bad that people were like blowing themselves up in their car trying to make quick meth, like just going down the road. And, uh, yeah, that's how bad it got. And it took a coordinated effort from all levels to even kind of get in front of it. And I mean, like I just said, 70% higher than any other state right now. Like it's still like that that bad. But that is what it takes. And
Mhm.
again, when I saw what was happening, I'm like, okay, well, I've been doing this e-commerce stuff for like 7 years. I know this stuff, like, from soup to nuts or, however you want to call it. And I'm like, okay, I'll just spin up my own thing. You know, how hard could it be? Yeah,
Huh.
you know, um, pretty difficult.
Well, we'll talk about that. Yeah, we'll come to
Yeah.
that. Mm.
So after I, was made redundant, I immediately just like registered the domain name and got the ball rolling through like LegalZoom for the registration and all that stuff. And I knew that things like, kind of took some time to kind of work out and whatever, and took a few months off for mental health. So, yeah, getting things up and going took some time. And once I started really connecting with my target customers, I quickly realized, yeah, I'm alone in this, and I need to learn more. I need to
Yeah.
be able to do better to serve these customers because it is public health, like the gamut across the board. And uh, started looking locally. So in 23, the Institute for Veterans and Military Families, uh, they were hosting a military entrepreneurship forum here in Jacksonville, and it was like, okay, well, that sounds like a thing. Let's go and take a look. And that's when I found out that there were a lot of resources for veteran entrepreneurship, um, more so for veterans than there are for regular folks. I mean, yes, here in Jacksonville, they do have the Jax Bridges program. Uh, from what I hear, it's fairly unique, like in the country. It is one of the largest ones, and it keeps growing. They don't advertise; it's just word of mouth.
Right.
Um, so I took multiple courses um, in 23 to be able to do that. And it paid off because 24, still working out the numbers with my new bookkeeper, uh, but like 10 times growth. It was huge. And uh, things are continuing to, develop.
Was something else you told me too, and I just want to get to sort of motivation. So in our pre-call, you also mentioned to me you had a childhood experience, right, with your mom wanting to start a restaurant, um, and that sort of not working out, and that left you jaded a long time about the idea of starting a business, right? So what would you say sort of reignited your drive, and what advice would you give to someone who's also feeling, similar level of disillusionment about starting a company?
Well, you're right. I was very disillusioned about entrepreneurship and, business in general,
Yeah,
uh, because, my mom tried to open a restaurant. It failed, had to declare bankruptcy. Life didn't get better after that. And I didn't want to go down that route. I
yeah.
didn't want to, take that risk because I thought that it was like that in that going into business, yes, there are risks, but now I know that there are ways to mitigate those risks so that you don't have to lose your house if things go south.
Right.
Unfortunately, it's like you don't know what you don't know. And you know, if I were to give anybody advice, and the advice that I do give everybody that I talk to is that don't go at it alone. Find the programs, connect with people first and foremost. Like don't be spending a bunch of money doing things if you don't have certain pieces worked out.
Right.
Um, I didn't follow my own advice. I kind of, went through it, and things fortunately have worked out for me so far. But, you know, things change. There can be freezes to federal funding.
Yeah.
Now, even though I was super jaded um, towards entrepreneurship, when it came time for me to say, okay, what am I going to do with my life? And this was an opportunity to make a difference. Seeing a place in the market that is underserved, that needs to be served for the betterment of society. Like it's we could be really dramatic about it, but you see a need, a
Yeah.
niche that you can address, you can serve. And if it's for, yeah, social good, that's all the better. But even if but you can almost tie just about anything, like, well, most business things to a social good. Even if it's entertainment, we need to be entertained and not bored out of our minds, and allowing depression to set in and all that stuff.
Yeah.
Um, I lost my train of thought. There's a lot to be done out there,
Yeah.
with
Yeah. But
entrepreneurship.
right. And it sounds to me like you were connecting, the mission is important. It's almost like that overrode the entrepreneurial or the business side of it, right? Or and it
Well,
sounds almost like a calling when you talk about it. And tell me a little bit about how much of that is sort of comes from personal experience too. You touched on that a minute ago when you were 15 to 17 in terms of medication or substance. Um, you know, did that influence sort of drive you towards solving this, as you said, a societal problem and a real need?
uh, well, growing up, it is one of those things where uh, I kind of learned that, I mean, nobody's going to come and save you in a
Right.
sense. Like, you got to
Yeah.
save yourself. So knowing that, it was one of those things that, with just looking at who else was in the game, I'm like, if I don't start this, like nobody's just going to. If all these folks think that nothing's broken, there's nothing to fix. It's all business as usual, without understanding the long-term impact of these decisions and what happens when you put things out in a certain way or operate a certain way. Like, products are misaligned, so to speak, but because it's a niche market that's not saturated enough, they can operate like that.
Yeah.
And again, yeah, knowing now that businesses businesses are businesses, and they only care about money. And if I can start something that competes in the net and forces them to maybe compete as well, adapt, do better for us. Ultimately, you know, it this is government procurement. This is our taxpayer dollars at work. And if you want to cut it down into it, a lot of this is funded, through the opioid settlement fund. And if you're
Right.
familiar, again, with that, and
Yeah.
there's plenty of people who view that as blood money, as souls of the departed. we need to manage it well. Uh, and, again, looking around at what's been out there, there are companies that are adapting and they're doing more and better. And I freaking love it. I love showing up to a CDC meeting and there's a competitor, air quotes, there, Nathan Langley from RX Guardian. Uh, and he's working on tons of stuff with them and
Right.
super engaged in ways that, I'm not. I'm over in other areas doing other things. But we all play our parts, with the ultimate goal of yeah, saving lives, doing better.
Yeah, true. There aren't a lot of missions that are more noble in that sense. So let's talk about a little bit about the, because you're dealing with a pretty complex issue, right? And also you're tackling a really important issue. And as you said, it's a societal issue, right? And it's an underserved market with Remedy Guard. So in a space where people are dealing with, sensitive and often tragic situations, how do you approach your marketing in terms of, sensitive issues like preventing overdoses or protecting children, like you talked about a minute ago?
So my target customers, well, they already work in public health or in hospitals in that sort of injury and violence prevention fields or substance use disorder, etc. And really, my approach is just how can I help you with your
Right.
efforts? Like, you know, is it just selling the lock boxes? Is there something more that I can do as someone with these experiences? Although nobody's quite taken me up on, any public speaking events or anything, like
Yet.
definitely here meeting that basic need of just like a reliable vendor. The
Right.
pandemic messed things up in so many ways, like, from a supply chain perspective. But yeah, really, it's just a matter of like, we're all in this together.
Yeah.
How can I help you? Do you have time for a conversation? Here's my catalog, or, what have you. But the most basic kind of opener I have is like, how can I help you?
Right.
It's what I'm here to do. Um,
Okay.
Nobody emails me asking how they can help me, so I think it's pretty effective, um,
Yeah.
and something that can be applied to, I mean, a lot of different verticals and whatnot. Like whatever you're doing, whatever you're selling, if it's yourself or a product, like, I mean, as business owners, I guess we're all selling ourselves, right?
Yeah. Yeah.
Uh, because, folks only do business with those that they know, like, or trust, typically,
Yes.
or it's the only option. Like,
Well, tell me. Let me head you. You said something interesting to me because we are sort of selling ourselves, right? So, how much of your personal story do you bring into the message?
I'm bringing more of
Yeah.
that to my messaging. Recently, did a big push, kind of opener with more the public health departments, letting them know that, hey, yeah, I'm somebody with these experiences, being a suicide survivor, not just my own, but like my father's as well. I guess there's a distinction for some folks, but being the veteran, being somebody who understands
Yeah.
lethal means safety and kind of knowing what happens when communities go without basic safety. That, like, youth mortality is going to continue going up, and like that, it has been. Like,
Yeah.
youth mortality is on the rise, and well, yeah, we all absolutely have to do more to like figure out why, like what can we do to prevent it, to help them make better decisions, and you know it's easy enough to say that. It's like,
Yeah.
what. implement that, sure. Yeah,
Yeah.
I didn't make the best choices, growing up. Again, like that's why I know these things are effective. If that handgun were locked up, I wouldn't have taken it out of that home. If my dad's Prozac was locked up, I wouldn't have swiped it. And if my parents' smokes were locked up, I wouldn't have swiped them. Like all that stuff. Like it would have deterred me from a lot of that behavior. So, you know, given like what it is and where we are as a nation with credit cards maxed out, savings all-time low, people working 3 jobs just to barely make it, and you got 6 roommates and etc. Nobody's thinking about this. Nobody's going to go out. I mean, I'll say nobody because I do get a couple little e-commerce orders here and there, but by and large, I'm pushing pallets to health departments so that they can have a community event and say, hey, you got a kid in your life? Come on down for some free pizza and a lockbox. Let's talk.
Yeah.
That stuff, and those events are doing more to repair this divide, between the distrust of the public and public health. There's been a lot of crap happening in the last decade or so
Yeah.
that yeah has caused an issue, and I don't really. That's a stat that I should look up, just like what is public trust in public health, but in general, like with anti-vax and all this other kind of stuff, it seems like it has eroded, like as a nation. So we're not listening to professionals and stuff. Um, through these events, folks can see that yeah, by and large, they are looking out for us.
Yeah.
They want us to be safe. They want us to be healthy. Um, I love supporting it. I really, it's feels good.
Yeah,
Feels
no, I can tell. And also, I think, the other thing I'd add to is like social media also paints this brush over all real problems and reality, right? So there's an element of that too. And I think, at least growing up, we didn't have exposure to some of the things kids are exposed to today, which definitely does not make your teenage years easier. If anything, it makes it a lot harder, I think, than it used to be even. And it's not like we didn't have problems in earlier generations, but I think it's sort of supercharged, some of those things that you're not ready equipped to deal with in your teen years.
absolutely not. And I mean, social media is a bit of a detriment, right? We're
Yeah.
learning more because it is, a new thing in human evolution. We never had anything remotely like this.
True.
And it's not just that it's social media. It's also the algorithms and folks
Yes.
behind that manipulate those algorithms for better or worse.
Yes.
I
True.
Okay, so tinfoil hat. Like, I
Yeah.
mean, that's the thing.
The odds are
And
stacked. Yeah.
it it's like it's this tool that can be used for massive positive change. It can also be used to trick a bunch of teenagers into eating Tide Pods.
Right.
Like, what the hell is that? You know,
Yeah.
uh, but yeah, great power, great responsibility, and something should be done I think, to address that. And what does that look like?
I don't know. We'll have to do a separate session on that one. I think that one
I'll let some other folks take care of
may
that.
need a few hours. So let me ask you. Now, you said something interesting to me also. Now, building a brand is hard enough, right? But you've taken on an additional challenge. You're also trying to shift societal behaviors around medication storage, and so it's beyond selling a product. You're also advocating for change, right? And you mentioned the word education. So tell me a little bit about how much of your marketing sort of focuses on education versus simply promoting the lockbox, right? Because you almost have to explain to people why it's necessary and what purpose it serves and sort of the underserved need that you're filling, and sort of what has resonated with your audience in this space. So sort of a,
So
yeah, go ahead.
when it comes to like my marketing efforts in advertising, it is towards the institutional buyers.
Okay.
Uh, don't really do much, as
Direct.
far as the individual, the end user, that parent or guardian, which I've said it before, like I really do need to do more to
Yeah.
to get their attention. I'm like, hey, look at what's happening. It's not just here, it's across the country, and y'all got to come together. And you need to get down to that public health department. You need to also talk to your public health department and see what you can do.
Yeah.
Like it, or get something, or the stuff that doesn't always exist by way of grants. The funding is hit or miss. Sometimes the grants are written so that they can make these purchases. Sometimes it's for other services or what have you. And it all is what it is. When they go and make these purchases, it's all evidence based. Nobody's going like, oh, I'm just going to go and do this. They see a need, they do a grant request, they put it out there. Someone, like, people will say, oh, yes, we're buying that. And then they go and they do their thing. Um, so it's like, a lot of this stuff is eventuality. What I do for my marketing stuff, I target certain events. Um, of course, being new to the sphere, I'm like, well, where do I go? And I try to find ones that are doing the work, that are impactful. Unfortunately, I can't go to all of them every year, and so I'm trying to be selective as far as, like, honing in on where this is going to have the greatest impact.
So the other thing I want to talk to you about was you did mention institutional. You approach institutions, right? And you said something to me which is interesting. You've contacted 4,700 pharmacies to promote your lockboxes, right?
I
So
started to.
okay,
So
you
I had that
yeah,
list. I
yeah.
had it up, and I got a few hundred in or so, and I the response was, it was like crickets,
Oh
you know.
really? Okay.
Yeah. In comparison to the other folks that I hit up, it
Mm-hmm.
was, yeah, it was not that great. Plus, looking at it, and um our pharmacies are independently owned mom and pop pharmacies. One,
Few
they're
of
not
them.
too tech savvy,
Yeah.
you know.
Yeah. Yeah.
Two, they are getting bought up and
Mm-hmm.
left and right by all these major ones. And
Yeah.
even if they are kind of independently owned, they're not independently owned. It's through like Health Mart, or which is owned by McKesson, or another, maybe a CVS type, deal, or one of those things where, yeah, it's not them. And so it's just different avenues. I don't think that's where my focus needs to be right now. Um, it's definitely with the sheriffs. They're they've been bumped up in priority for my next salvo.
And so tell me, explain. So what do you think was not effective with the pharmacies? Is it just it's too fragmented? What? Because you would think they have robberies. They have pharmacists. I believe there's a large number that are addicted themselves. So wouldn't that be like a natural place to?
For some, and
Yeah.
I think one state, there's a requirement for medication lock boxes to be there.
Okay.
When you're dealing with like the pharmacies and stuff, I'm not sure why I haven't particularly heard back
Yeah,
from them.
yeah,
Um, it's they're they're in the medication business, so unless it's either at a I'm bigger, or the request comes from maybe that nonprofit, the health department in their community, or the sheriff, or the coalition, or whatever in their community, they'd be more responsive to. But
got it. Yeah,
I completely understand that I'm noise to a lot of these folks.
right.
But you know what it is. But you can't say the wrong thing to the right person. You know, and you can't say the right thing to the wrong person. Like they're just not listening.
Yeah. And so sheriffs, you feel, because so you just sort of talked about, so if because they're sort of the center of this, right? They're the ones going to these homes. They're the ones answering the calls when the tragedy happens. Is that why you're saying sheriffs? And also they're still, I guess, a respected authority. To your earlier point, where institutions perhaps have lost a lot of trust, but
So the CDC funds
yeah,
drug-free community coalitions. For that coalition to be formed, it needs representation from all 12 sectors of the community. That includes public health and law enforcement. Now, when you look at law enforcement, sheriffs are elected officials.
right,
They're the only elected, law enforcement. So they already have um, an ear to the ground in
right,
their community. They're already trusted, by
yeah,
and large in their community. And again, I believe that quite a few of them are involved in something like that in those community outreach programs.
got it, yeah,
I don't quite know how many yet, but I believe that while there are, yeah, a good number of them involved in something like that, that uh, they're not quite sure so that the rest of them, they're not quite sure either, like what's to do, what
right,
specifically to act on. They're doing things, yes, and this is another way to be involved, and with it being that community coalition versus just law enforcement effort, uh, one, the public will be more receptive
yeah,
that there is all of this, but without their involvement, these coalitions have a harder time forming. Uh,
right,
if the sheriffs are made aware that their help is needed, I believe that we will see a surge of these coalitions being formed soon. Uh,
right,
because they
yeah,
do want to be involved, they want to do more, but it's just like, well, what, when, where? You know,
yeah,
that's one of the bigger things, and yeah, I just need to grab one of the sheriffs that are already involved in those coalitions and be like, give me a 30 seconds of how it is. What is the impact on your day to day, and what's the impact in your community? And then use that as like kind of a soundbite, like, hey, Sheriff Smith over here is involved with his local drug-free community coalition. It's a 2-hour commitment a month, and they've seen an 80% reduction in prescription drug use in their youth. Something,
yeah,
I mean,
right. Well, I
no.
think it, yeah. No, it sounds like a smart strategy, and I'd love to hear how that goes once we talk more. So the other thing I want to talk about, something you talked about at the beginning too, and you told me you spent a fair amount of time and money on design files, right? And you wanted to manufacture in America, and you sort of and you looked around, and then so tell me a little bit about what that experience taught you about the product development process.
Looking at domestic manufacturing took 6 months, $4,500 minimum. That was just the CAD, the engineering for those step files and whatnot. Uh, And it's kind of sad, you know. Again, it was 2022 pandemic. There were a lot of manufacturers that were like, we wouldn't mind having our engineers look at something like this or think about something like this, but we can't. We can barely, there's absolutely no way to do any of this. And, I went through hundreds of manufacturers, and I got quotes that range from like $250 for a prototype to $2,500 for a prototype. And it's like, okay, well, I just don't see this happening in our country. I just don't
Yeah,
see this manufacturing happening right now, not where we're at. I think it'd be possible to like uh, license or something the box design from the manufacturer in China and have something spun up here in the US. So there's one, not as much of a lead time
yeah,
when these departments are like, hey, Matthew, I would love to get this color or these stickers put on it or what have you. Once, right, well, and right now because I'm operating really lean and I'm not sitting with my inventory, like doing a sticker project or something like that, it's quite cost prohibitive.
right.
Um, so, trying to do that during production, that's like, the most cost effective thing. But lead time is 90 to 120 days. And
Wow. Yeah,
yeah, well,
that's
between production and then
well,
transit time.
shipping. Yeah, yeah. So let me ask you, Matthew, if we were to meet again, 3 to 5 years from now, what would you want to have achieved? Where do you want to be?
I would like to have domestic manufacturing under my belt, all of that in place. I would like to have people in Remedy Guard working on it so that if I get hit by a bus, the show
It,
don't stop, you know?
right.
Um, and then, being able to say, hey, uh, that coalition idea took off and we doubled the coalitions and now there's 1,500 instead of 750. Now the glass is half full,
Right.
a bit more, you know.
Yeah.
Uh, that's yeah. I'd love
And
to be
the
able to tell
impact
you
in the
that.
community would be awesome, right? I mean, the results would speak for themselves, I think, in terms of the, the as you said, the prevention is better than the cure, right? I think people need to sort of, that has never sunk in for humanity, I don't believe, but yeah,
No, and we we are pretty wasteful when it comes to stuff, thinking that things aren't going to catch up, and that we can just go on doing
yeah,
things
nothing will break.
however.
Yeah,
But it all catches up, and we have to address it. And until we figure out that root cause of the youth mental health crisis, we have to make that stronger effort as responsible adults, whatever we're doing, and yeah, keeping them protected and educated about realities of things,
yeah,
and how we there are substances out there that can kill you immediately if you take too much of it, and there's other stuff that won't, but it can put you in a bad way, and that's not good. And yes, my body, that was my thing when I was using drugs as a teenager. My body, my choice, and you know, I'm not hurting anybody else. And
right.
if I die, who gives a shit, right? But a bit older, a bit wiser, and understanding uh, the impact of certain decisions, on others and how things can play out. So it'd be cool if we could, you know, have a better conversation in our country about drugs, without all the different stigma and being able to tell youth, like, yeah, you're not going to die if you smoke weed. And reefer madness is bullshit. But if you go and you start camping on a 90% THC distillate cart, you might develop some problems.
Right.
And instead of freaking out that a teenager is just even doing that, be like, why are you doing it? Can
Right.
we start talking about that and approach things that way versus, um, just like the straight like incarceration or, what
Black and
have
white.
you, or
Yeah.
right. It's like, obviously the kid's going through some stuff. Like, let's just have a conversation at
Yeah.
least, and try to like, do something. But yeah, hopefully things move towards that way. And if everything that we're seeing is holding up and how they are, all the outreach professionals are using evidence-based prevention and, really talking to people about this stuff,
Yeah.
uh, then it's great. And it's not stigma inducing. And we're all going to be able to talk about this stuff more, in the future
Yeah.
without, having to toe a line or anything.
Yeah. No, I think it's a great message, and I'll be rooting for you, and I'll definitely, I think it's a noble cause. So, if you could offer one piece of advice to somebody wanting to start their solopreneur journey, what would you tell them?
It might be solopreneur, but don't go at it alone. Build a team. Find those trusted professionals. Your lawyer, your your bookkeeper, finance, CPA person. Get
Yeah.
those people under your belt for sure. Before you go into this stuff, don't be like me. Don't be like my mom. Um, you know, have those folks in place and get connected, even though you're a solopreneur.
Yeah. Find your tribe, right? I think that's a great message. And I think it's so
Absolutely.
important for mental resilience, for support, for so many things, and even knowledge sharing, right?
Absolutely. Yeah. It's part of your uh, physical and mental wellness maintenance. It is checking in, having your tribe, checking in with your tribe.
Yeah.
That, I mean, that's another thing though, is just the loneliness epidemic in our country as well. And I mean, if
True.
things weren't bad for a business owner before, like hey, everybody's so isolated now in so many ways.
Yeah, no, I think that's a good message to to take us into our rapid fire round. So, um, here, whatever comes to mind. So, what's a survival skill from your military days that surprisingly helps you in entrepreneurship?
Survive. Okay. Um, Operate kind of quietly under the radar, making sure like that my competition doesn't really know what I'm doing, and then all of a sudden I'm there. Like, when I show up somewhere and Nathan sees me, I feel good. It's like, yeah, surprise. And that person, like, wearing camouflage.
Smart stealth. I love that. Um, what's something you thought you'd hate about running a business but actually love?
Talking to people. Um,
That's
you
great.
know,
Yeah.
I, yeah, I was IT previously, but it wasn't that kind of stereotypical in a cubicle, never talk to anybody. I was a focal point, so I had to talk to everybody all the time. And I thought I'd hate continuing to do that. I thought I could just be like the Wizard of Oz in the background, but I'm really enjoying it.
That's great, and I'm glad you chatted with me today. So thank you for that. If your entrepreneurial journey was a Netflix show, what genre would it be?
Um, Probably some mockumentary.
It's
At
fun.
least I'd want it to be something like The Office,
Yeah, yeah.
give some
I
levity
think
to the situation.
you need that. Especially, I always feel like the more serious the subject, the more levity you need, right? So, because we, that's what gets us through the darkness. Um, What's the best piece of advice you've ever received from a fellow veteran entrepreneur?
Don't go at it alone. And now I'm passing it on. Don't go at it alone.
Yeah, that's a great message. Um, if Remedy God were a superhero, what would be its superpower?
Duplication.
Duplication?
Yeah. So
Oh,
like,
so yeah,
the ones that can just like double, 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 double,
yeah,
double.
yeah.
If I could
Love
do
that.
that,
Yeah.
game over for everything. Like I'd be in every home overnight.
That's a brilliant superpower, and I hope you find a way to do that with domestic manufacturing or however else. So Matthew,
Props.
thank you so much for sharing your story so honestly and talking about your journey and sharing all the insights and wisdoms you've learned along the way. I really appreciate you having uh, come on the show.
Thank you for having me, Gil.
Matthew's story isn't about building a product. It's about challenging a system that prioritizes convenience over care. What struck me most? He's not selling lockboxes. He's reshaping behavior, rebuilding trust, and closing the life or death gaps between institutions and the people they're supposed to serve. Here are my key takeaways. Trauma can transform into purpose. Matthew's childhood trauma and his own suicide attempt didn't just inform his business, they became its heartbeat. Solopreneurs, your wounds hold wisdom. Don't hide from them. They may be the key to your most meaningful work. Marketing is education. Matthew's biggest challenge wasn't building the product, it was helping people understand why it mattered. Remember, if your work is unfamiliar or complex, clarity is your first deliverable. You can't sell what people don't yet understand. Find your champions in unexpected places. After initial outreach to pharmacies fell flat, Matthew found unexpected allies in sheriffs, elected officials with community trust and influence across sectors. Your best advocates aren't always the obvious ones. Look for people who have trust, not just titles. Realities can reshape your vision. Matthew's vision of American manufacturing clashed with cost and pandemic realities, so he adapted. Don't let perfect be the enemy of good. Start where you can, build traction, and work your way towards your ideal model as you grow. Don't glide it alone. Matthew's military training taught him stealth. Entrepreneurship taught him a harder lesson: ask for help. Solo doesn't mean being alone. Build your network. Your mission is too big to carry solo. Whether or not you're in public health, Matthew's dedication is an inspiring example of how solopreneurship can be a vehicle for creating meaningful changes. And it isn't just about building a business, it's about building better systems powered by people brave enough to try. Thanks for listening to Unfiltered Solopreneur. If you got value from today's episode, subscribe, leave a review, and share it with another solopreneur who needs this message. Until next time, keep breaking free from the corporate grind, and remember, your story is your most powerful asset. Live solo or die corporate.